Welcome to another e-value tutorial video. This video is to teach you to use PxDx, which is where you will document your clinical interventions while on IPPEs and APPEs. So we're going to do a scenario if you are on an APPE or an IPPE at a hospital setting. You notice in a patient chart it states allergy to penicillin. It does not clarify what type of allergy occurs. Being the good pharmacy student that you are, you ask the patient about the allergy and they say they have GI upset. So you document that this is not a true allergy and think the patient should be on penicillin because this is the best antibiotic for the infection. You then proceed to clarify to the doctor you would like to change her medication to penicillin.
So now you have completed this intervention, and you need to document it. So in order to do this, click on PxDx, then click Add New. First, you will list the date of the interaction, as well as the course, rotation, or activity that you did this in. So for example, if you are on APPEs, you choose the corresponding APPE and APPE site. And if you are on IPPEs, you can scroll down and choose the corresponding IPPE. Next, you will choose the preceptor or supervisor under which this intervention occurred. If the intervention included a specific patient, you will include their age, gender, and race. If, for example, the intervention did not involve a patient, so for example, you made a change to a formulary, then you would choose Not Applicable. This next section allows you to choose the type of drugs that were involved in the interaction. If the drugs are not listed, you can choose Other, specify in notes, and you will have the opportunity to specify it in the other section below. In this next section, you have the opportunity to document any interprofessional involvement. So for example, if you worked with a resident or a PA student in order to make this intervention, you will note it here. Note, this does not include pharmacy students or other pharmacy residents. These involve other professionals outside of our profession. In the following notes section, you can explain anything that you have clarified above, anything prior to this point. Next, you choose the person who identified the need for the intervention. So for example, if this was something that you found on your own, you would choose Student independently. If this is something that you did with the help of your preceptor, you would specify that as well. Also, you will note the intervention outcome, what the prescriber did as a result of your intervention. Then you will choose the patient response, what happened due to this intervention. Next, you choose the clinical activities. So for example, in this case, you clarified an allergy. So we will choose this one first. Then you select your role in the clinical activity. This section gives you a little bit of an opportunity to document anything that you feel is appropriate due to the intervention. It gives you the opportunity to describe the intervention. Then click Add Clinical Activity. At this time, you have added the first clinical activity, but if you recall the scenario, you identified and clarified an allergy, and this resulted in antibiotic change. So now you need to add the second clinical activity. So you click Antibiotic Change, and if your role changes, you can also change that in the Select Your Role section. So for example, if you clarified the allergy, but then the physician helped you pick the appropriate antibiotic to change it to, then you would change your role from performed independently to some help from preceptor, use your clinical judgment. Then you click Add Clinical Activity. Just note that in the group section, this is the only section that you do not need to fill in. You can leave it as all groups. So now that you have both of your clinical activities documented in the same intervention, you can click Save Record. And then your record is added, and you can review and edit this from the Review Edit button.